Family health traditions. Cultural competence requires knowledge of yourself, heritage, and the health and illness beliefs and practices to which your cultural group subscribes. These beliefs and practices may also flow along religious and or ethnic lines. The ethno-cultural history of each group is different. Our patriarchal and matriarchal history may also be very different. It is important to know how your family maintains health, protects health, restores health, and cures diseases. You will soon discover that some of these beliefs and practices are similar or very different to your peers. Getting to know your heritage. There are two reasons for exploring your familial heritage. First, it draws your attention to your cultural and religious heritage and health related belief system. Daily habits, such as saying grace before meals and praying for the sick, are passed on by parents and other family members. Behaviors are both subconscious and habitual. By digging into the past, you can recall some of the rituals your parents or your grandparents performed. Second, knowing your familial health practices sensitizes you to the role your cultural and religious heritage have played in your life. It forces you to reanalyze your concepts of health and illness from a different perspective. And if your family background is presented in class, your peers are able to view your ethnic group in a different light, and vice versa. You may be surprised to discover the origins of someone's family health practices. The roommate's mysterious or weird behavior may be explained by reflecting on its origin. It may also be surprising to realize that what we think is unique to our own family is actually practiced by families in other cultures. Consciousness raising. As you progress in your professional course of study, you will soon realize that many of your personal beliefs and practices differ from what is being taught in nursing, health, or medical education. For example, do you seek medical attention at the first symptom of an illness? Do you go online to search your symptoms and diagnose yourself? How many home remedies will you try before you seek treatment? Do you really have the time to take off from work? And do you have to choose between spending the money for your copay or groceries? You may have a variety of feelings about the self-care practices of your family. For example, you may feel ashamed or embarrassed when some of your family's traditional beliefs and practices are discussed. These beliefs may be labeled by the professor or peers as nonsense, quackery, or superstition. And you may also feel conflicted as to whether to believe the old ways or to drop them and adopt the more modern ones you learn in school. The awareness you gain from understanding your own beliefs and behaviors will help you understand the behavior and beliefs of patients, and for that matter, other people better. You will be more comfortable asking patients how they interpret a symptom and how they think it ought to be treated. You may also be empathetic as to why some people delay going to the doctor or do not comply with prescribed treatment. From a scientific perspective, the majority of traditional practices have a sound basis. For example, health maintenance practices almost always adhere to universal activities that include rest, a balanced diet, and regular exercise. The goal is to understand that we individually and collectively practice a certain amount of traditional medicine. Like our clients, we often delay seeking health care, and we must treat some of our symptoms with home remedies with or without a prescribed medical regimen.